Morning and welcome to this special program brought to you by LAMU Medical Series, where we discuss health careers that shape community, strengthen health system, and save lives. Now, today's episode, we look at something quite interesting and very important. That's clinical medicine matters, and we focus on one of the most essential frontline discipline in healthcare, clinical medicine, but also a profession that bridges community and hospitals, and obviously issues of treatment, urgency, and continuity of care. And joining me this morning is Dr. Teddy Andrew Mulenga, head of a department for clinic officer general training, and Miss Olga Shinondo from corporate communication at Lusaka Apex Medical University. I welcome you both to this special program.
Thank you for having us.
Dr. Teddy, I think this is the first time we're interacting. Happy New Year. How was the New Year so far?
This is my home. It feels good to be back.
Feels good to be back? Yeah? But I just want to get started on this issue. And I think maybe to start off is to establish what clinical medicine is and what it is for some of the viewers that are watching. And then we can progress from there.
Right. Clinical medicine is like a bridge between medicine for doctors, and nurses. So it's like a midfielder. A clinical medicine practitioner is a midfielder. He's the one who distributes the ball to the doctor and to the nurse. So it's like a bridge. So it involves the same clinical skills that a doctor gets, but a little bit just lower and a little bit more than the nurse. So it's some sort of a middleman. The clinical officer general is the one which clears the way for the doctor. He takes on the bulk of the patients and leaves a little bit for the doctor, which needs consultation. That's the role of a clinician. Right.
And one would want to just establish even more in terms of role and responsibility. Maybe if we trickle it down to a hospital facility, one would ask a question, then what is the role of a clinical officer and what do they play within the health care system?
No, you see, the hospital is organized in 3 tiers. There is nurses. We all know what nurses do. They take vital signs, temperature, BP, generally they just ask general questions so that they can know where to channel you. The clinical officer is the one who is in the hospital setup. He's the one who is responsible for the mass of the patients. 200, 300 people per day. Either 2 clinical officers or 1 sometimes even. A doctor cannot do that. A doctor will be doing a cesarean section somewhere, you understand? So the clinical officer goes through these patients, complaint by complaint, makes a diagnosis, treats. Where he cannot, he gives those people a referral to the doctor. So they have to wait. So this is the role of the clinical officer. It's sort of to screen the patients as they come. Go through all of them without, doubt, everybody, and make a decision. This one we shall treat. This one will wait for the doctor. So they are the main pillar of consultations in our facility.
So it's like a chain in this case, meaning that there's a role that's very important at a certain level, driving to a doctor. Maybe also establishing more context here is we have a doctor and we have nurses in this case. How does that work out now before the doctor even receives any information from the nurse? How is that arrangement like?
Okay. The patient comes to a facility. They are, for example, coughing, right? The nurse is the first person that patient will see. So sits down there, and the nurse says, okay, here's the temperature, here's what, BP, and maybe sugar sometimes. They measure the sugar. So she keeps those in the records, and of course asks a few questions, because sometimes it can be a gyne problem, or a surgical problem. So at least just preliminary, some question. What is the problem? They say, no, I'm coughing. Okay. That means that the next stage now, there's a room for consultation where the clinical officer is sitting. They go and line up there. They have got the vital signs taken. They enter in there, the clinical officer then screens them. None of them have seen a doctor. The clinical officer goes through that one. And if the problem is manageable, he prescribes the medicines and the person goes to the pharmacy. End of story. They haven't seen a doctor. So not everybody sees a doctor. In fact, in Zambia, do we have them? There are very few.
Interesting.
There are very few.
Now, this is a program that LAMU is offering, and I don't want to shift to you, Olga. I know Dr. Teddy, we're going to expand more in terms of just also the trainings. But before we get there, maybe, Olga, I would like to get an insight in terms of how long is the clinical medicine program for some of the newly graduated students, pupils who want to come to LAMU to obviously be trained in this profession, and what are the personal qualities and interests one needs to have?
All right. So here at LAMU, we offer it at diploma level. So like most diplomas, it is 3 years. But within those 3 years, this has got to be one of the most hands-on, condensed programs that we have. So naturally, within the first year, you will be given your basic medical foundation. However, as soon as you get into second year, we will throw you into placement sites, firstly within Lusaka. Now, you will learn the four medical pillars, as I like to refer to them as. What are those? Obstetrics and gynecology, internal medicine, surgery, as well as pediatrics. So that no matter what type of cases you find within the ward, at least our clinical officer generals are well-rounded. Then, within that second year, you will also have components of public health as well as oncology. For those who are wondering, what is oncology? Oncology is the diagnosis, treatment, as well as the research or study of cancer. That would be the tumors and the like. Now, by the time you've gone into third year, we're now throwing you into the rural urban areas. Now, within that, we've noticed that there is a rise in the need for mental health attention. So within that, we have the mental health component as well as psychiatry. So that way, once we have graduated you as a clinical officer general, you will be well-rounded no matter where we have put you. You have had urban exposure, you've also had rural exposure. There's also another component I really, really want to stress on. So LAMU, we are not just training people to work in the system. We are training people to manage the system. So within that, especially within the second year, you will already start learning it's health system management.
Why is that important?
Because, first of all, we are training who? The future leaders, the future managers. So that way, haven't you noticed, to allude to what Dr. Mulenga said, at times you will meet the clinical officer before you meet the doctor. And at times, especially in the rural urban areas, most of these facilities are run by the clinical officer general. So this is a skill that they genuinely need in order to manage these facilities. So that means they should be able to manage the inner workings of whether it's a hospital or a clinic. Not just being able to see the patients, but to also set it up in a way that as soon as the patient comes in, they are processed, they are managed, they are treated, out. So that it's a nice flow. So that people are not in queues for too long, as well as their current condition is not further frustrated by the system. Then, what are the qualities? I know a lot of us are already aware of qualities such as you definitely need empathy, because you can't shout at patients, you can't fight with the patients, you can't. And you need to understand that this is someone's mother, father, child, and alike. You also need to have a very, very strong diagnostic capability. What does that mean? You should be able to take good patient history. What is patient history? Back to what he said, when your vitals are recorded. Was your sugar taken, your BP, what all of those were, your symptoms, was everything accurately, clinically recorded, so that way, when we move on to the next stage, or rather when you move on to the next stage of treating your patient, now it's the diagnosis. Because you took a strong history, you are able to now say, all right, based off of this and that, let's do this type of a test. Based off of what? Then that will move you into the next part, which is treatment. Treatment, whatnot, and then even after that, management. The foundation of good medical care is you need to take a powerful history. That is your foundation. It is, think of it this way, this is the full statistics, the full rap sheet of your patient, and that will tell you everything you need to know moving forward. Another thing, you need thick skin. You will deal with patients
Like a
who...
crocodile.
I wanted to ask, how thick should it be?
Because your patients are in pain, they are frightened, they are frustrated, they're angry. So some of them, they will curse you out. They will shout at you, they will insult you. And don't forget that you will be caught in between family dynamics, where naturally the relatives are frightened, they're worried about their patients. So you have to deal with all of these dynamics. So you need to not personalize when somebody tells you off.
Yeah.
Also, you need the ability to brush off the experiences that you've had. For example, some of your patients might not make it. They might pass on and the like. So how do you deal with that? One odd bit of advice is actually you need a sense of humor.
I think we're going to stretch more as we get into, I think one of the key components, apart from what has been mentioned, that I'm also picking out as we venture Dr. Teddy Mlenga on the clinical training itself, which according to LAM, it's very handy, hands-on. I want to understand what practical skills then and clinical exposure do students get to gain during the training program itself at LAM?
Right. What we do actually right from the first year, apart from the fundamentals of science, anatomy, physiology, biochemistry, biomedical sciences, laboratory stuff, we equip them with, paramedical skills, sort of. These are skills where someone can respond or understand an emergency. So we equip them with fundamentals of emergency medicine. That is, if you are walking in the street and somebody starts to fit, what do? You don't just sit there and start crying. No, I'm a clinical officer, but no, what do you do? Somebody is fitting. So we equip them right from the first year because this is 3 years, it's condensed. So we equip them. You find somebody in a asthmatic attack, what do you do? So our clinical officers right in the first year, they know how to respond to epilepsy. They know how to respond to high sugars or low sugars when somebody collapses. These are fundamentals of paramedical assistance. And then we also equip them with, skills to respond to injuries. How to stop bleeding when you find somebody injured and they are bleeding. They will die from, hypotension, shock, low blood pressure. So you have to respond very quickly. And we want them to have these skills very early because life does not wait for you. We are teaching you here. You are going home, somebody is hit by a car and they are bleeding. What do you do? And you say you are a clinical officer trainee. Help us, man.
I was for the idea that let's say there's an emergency, for example, like you have said, there's a person who's badly injured and they are brought in quickly, rushed to the clinic, and you are there. Part of what you're talking about and also what you talked about in terms of attitude, but I want to stretch more is that in terms of the training, so they don't have to freak out to say, what am I going to do next? Or what's going on here?
No, we have right from the first year, we have skills lab, right? With mannequins, if dolly, okay? So these people, these mannequins have got veins, the heart,
or the human-like.
Lungs, everything. And we teach them, for example, if the heart stops moving, what do you do? Work on that human being there. They study, did you? And they see if they are making sense. The machine is picking the effect, if it's working or not. So we teach them that. Then in emergencies like, accidents, bleeding and what, those mannequins have got everything that you need to know. So if we tell you, go for the arteries all the points are shown, and, we teach them where to press in an emergency. And also, most important, what kills people in an emergency is in an accident is wrong positioning of the person. Touching wrongly. Because you have seen what our people do. They find somebody is injured. They start moving them up and down. They don't know, maybe there might be a spinal injury. So we teach our students the correct way to approach an injured person, not to make the injury worse. Because you can actually, if there's a fracture of the vertebrae, the spine, moving a patient in such instances can result in transaction. That means the cord they stop breathing. So we emphasize these things very early to our students. In the first year, by the way. Yeah. It's very important.
Yeah. To you, our viewers who are watching us live, both on our Diamond TV online, you can participate via the number showing on the screen. And we'll definitely be able to allow you to come in with a question or a contribution to any of our panelists here. We have Dr. Teddy Mlenga as well as Olga Shinondo, who's joining me live in the studio here. And I want to stretch up more in terms of, here's a graduate, and I know you mentioned in terms of qualities, and obviously stemming down to also issues of qualifications, who those who would want to pursue this particular program. But once you're enrolled and the training has begun, you have been capacitated with these skills that are very important once you begin operating. Mm-hmm. Do you normally, because they are stationed in different hospitals, some of these students, you never even know where they are. Maybe they might be in Shangombo, one of the hospitals there, maybe in Mpika district, Chipushi village, Kaputa. Mm-hmm. But do you normally get feedback in terms of their functionality in these hospitals as a university to say, these people that we have, because they're coming from a university, I think they're well trained?
We do. First of all, before they even graduate, we already get feedback from them from their placement sites. And it's usually that uniform. We actually have patients who often say, I want to be treated by the students in the LAMU or the Apex uniform. So already the demand for them during the practicum site placement, it's already high. Then once they've graduated, we often hear good stories about our alumni. So let's say, even some of the people you just meet along the way, should they see the LAMU branded vehicle, anything to do with LAMU, they say, somebody from there treated me, or somebody helped me with this and that. And a lot of people speak very highly of how they were treated, not just as a patient, but as a human being. That's one of the biggest things people usually point out with our students and alumni, other than how excellently they are handled.
Let me just add, you know what has happened to LAMU? First of all, it was established by one of our the biggest prominent surgeon, Dr. Munkonge, right?
Yes.
Now we have people who have actually been my teachers. We have very long-standing professors there. So the culture, what she's talking about, is a culture of long-standing service translated into us, the younger ones. There's Professor Lambert there. There is Professor Njeresani. These are long-standing serving servants in medicine. They have worked. Dr. Mlenga, they are from TDRC. And so now the culture from these long-standing, professional workers is permitted into what she's talking about. The culture into the students is coming from these professors of very high standing that we have. There are very few universities that are private that can compete with us. The quality of staff we have. Now, pure gold.
Now, Dr. Teddy, I understand that another element, you mentioned the fact that once they're capacitated, obviously there's certain things that they wouldn't get surprised by. You mentioned about certain patient that normally comes to the hospital with different challenges. Obviously, they're not freaking out. But what I understand, they're humans as well. And as humans, obviously, there are some issues where you can't take it anymore. I understand part of the training, whether there's an element where how one can take care of their mental state, because sometimes being a human, there's so much you can do to stretch yourself. But seeing dead bodies, seeing people injured, wounds, you can't freak out, but as human, I want to understand the training as we talk about always the issues of human machine.
Yeah, you are human indeed. But you know what? The way we go around the humanness and the possibility that you just burn out is to expose you to rough terrain very early. We send you into Chilenje Hospital. There are people dying daily there. You understand? There are people getting injured there. There are people in asthmatic attack, very sick. There are people with meningitis refusing lumbar punctures. Every day there's a meeting with relatives trying to... So you get, like she was talking about a thick skin like a crocodile's. Why? Exposure. Once you take your students into the hard places, they pick up the survival skills. You know, most of us, when we are trying to go into medicine training, we were thinking of blood. You know, I don't like blood. I don't like the color of blood. People dying. You get over it. It's part of your life. You live it. So the answer is exposure. Once you expose them into, at first they go with dead bodies. They come with a fear of dead bodies. Then we expose them to the bones first, the skin first, and then the whole body is dead. Now cut it. You haven't touched the dead human being yet. That one is an old one with formalin. The body is treated. You haven't touched the fresh one. We are going there. So this is the way we start our students. They start from low. By the time they are reaching there, they are not afraid of blood. They are not afraid of seeing somebody dying. They don't celebrate, but they are not afraid. They don't freak out because they have seen it all.
Yeah. Now, Dr. Teddy Mlenga, I don't know that we are split of time, but your last remarks to the viewer watching, I mean, this is a noble cause. I mean, this is a noble profession, and one would want to just get a glimpse to say if probably what I'm hearing is making a great deal of sense and I'm interested. I mean, what message would you leave our viewer out there to take away as they prepare for their future?
Okay. What I tell students is that not everybody can be a doctor. Okay? There are certain qualifications that you need to have. But you don't give up because clinical medicine is less strenuous. It is shorter, 3 years. So that you can go and look after your mother or your brother and sister, quickly. You go and, finish. So it's cheaper and also it is manageable in if you compare it to medical training per se, at least you'll be sleeping some nights in clinical medicine. That's what I tell them. So it's short, cheaper for you, and but it equips you. You are almost 3/4 of a doctor.
But the work is also rewarding, isn't it?
For less. You have spent less, 3 years, and you are done. Then we send you to Kaputa. There you'll be the administrator there. You order the drugs. You are the chief. You order the drugs. You issue the drugs. You take people to the mortuary. You are the commander-in-chief. That's what a clinical officer is. They are the pillars of medical help and assistance in the rural areas. It's not the doctor. They are not there. By the way, you know that we have got 1 doctor to 9,000 Zambians. 1. WHO recommends 1 to 7. We have 1 to 9,000. That's how bad it is to a doctor. To a health worker, if we take all the health workers, we have, for 1,000 individuals in Zambia, we have 1 health worker. That's how bad it is. So as a result, the clinical officer stands, you have built 650, 650 health posts. You think we are going to have doctors in there? Clinical officers and nurses. So please come forward.
Yeah.
You are needed.
I know, Olga, I understand, just to wrap it up, it's whether the enrollment, I mean, for those who want to enter into LAM, obviously through this program, whether it's still open. I know we're just almost a month into the second month. I mean, we're early into February, obviously, but there are those that did not make yet a decision to what program they want to take. They're still debating. What should I do? I mean, now I'm interested in this. What steps should I take? What's the call to action?
Call to action, immediate. Apply now, enroll now. But what do you need? You need a credit or better in English, math, biology, science, or chemistry and physics if you did the pures, and any other subject.
In agriculture science.
Whatever it is, commerce, whatever the fifth one is, not a problem. Now, we are still enrolling for our January intake. Our late admissions are still underway. But for those who can't make it for the January intake, July intake is open, seeing as how we have 2. So that way we catch anybody who might have whether received the results late or for any other reason, we are open to all. Now, where to apply? Our website, www.lamu.edu.zm. One more time, Siri, www.lamu.edu.zm.
Well, I hope you got it. It was a pleasure interacting with you, Olga Shinondo, Corporate Communication Officer at LAM, and also Dr. Teddy Andrew Mulenga. It was great having you on the program. Very insightful, very interesting midfielder. Home takeaway point there. The child was on. Well, to you, the viewer out there, if you're interested in enrolling in this program, you definitely have to visit their website and make sure that you make that decision now. It's never too late with LAM. And like I always say, whatever you might be doing, make sure it's profitable. And guess what is profitable? You getting to do the right course. And clinical officer at LAM is the right choice that you could never regret. My name is Ndanji Dange Simons. Until next time, it's bye-bye. God bless.
Thank you.
Apex Medical University. Enrollment is now open for January and July 2026 intake. We prepare you for real-world health careers when you study bachelor's degree in medicine and surgery, clinical anesthesia, physiotherapy, public health, nursing, pharmacy, nutrition and dietetics, and environmental health. Diploma in clinical medicine general, diagnostic medical ultrasound, nursing and midwifery, masters in medicine in radiology, hospital and healthcare management, and many more, including short courses. To apply, you need 5 O-level credits or better in English, math, biology, science, or chemistry and physics, and any other subject. Learn in the lab, in the field, and in the classroom with experienced lecturers and gain skills that matter from day one. Enroll for January or July intake with flexible payment plans and blending learning. Apply now on www.lamu, spelled lamu.edu.zm. WhatsApp admission on 0750-193-851 or call 0974-137-203. Email admissions@lamu.edu.zm. Lusaka Apex Medical University. Knowledge and excellence.